Children can have hearing loss for a couple of reasons. The most common reason that children have hearing loss is because something is occluding the passage of the sound or the noise getting to the hearing nerve. As opposed to adults who generally have nerve-related hearing loss, fortunately, children more often have a correctable cause. Something's in the way. Wax, fluid, very commonly. Often we'll know that coming in because in Iowa we have such great newborn hearing screening programs that children who have some hearing loss at birth, nerve-related hearing loss, come to our attention very young. So as children age and there's a concern for hearing loss, it's most often a correctable, conductive hearing loss like wax or fluid. In children, ear infections are very common. It is all about the anatomy that connects the nose to the ear. That eustachian tube is flatter, it's shorter and wider. In the back of their nose is this tissue called adenoid that contributes to these ear infections. While children have ear infections, there's fluid in the middle ear, and there's about a 20% hearing loss during the time that fluid is there. And if a child has recurrent ear infections, we know that or the treatment that they receive, especially if they have to have IV antibiotics, which is very uncommon, but if they have high dose IV antibiotics, that can contribute to hearing loss. Most often, though, the hearing loss that is from an ear infection is from the fluid that's in the middle ear, that once that resolves or is removed in surgery, that is a correctable hearing loss. Some hearing loss in children is permanent, and that's the nerve loss. There are some conductive type losses that we can't correct. Even when we try in surgery, we don't get that gap, so to speak, closed. But some of it is permanent and can be treated with amplification like hearing aids or preferential seating in school in a mild hearing loss. But some of it, that nerve loss is inherited and a part of that child's life from the very beginning, treated with hearing aids. Infancy and young children, that hearing loss, fortunately, we often pick up in the newborn hearing screening. Otherwise, parents are quite astute. They can tell if there's something not quite right about their child. This child doesn't startle the way that the other kids around them do. This kid isn't responding to their sound or their name as readily as the other kids or that they used to. So if there's a concern for hearing loss, the best thing to do is certainly you can start with pediatrics and family medicine, a good exam. Is there wax? Do they think that there's fluid? But the best thing is to be seen by audiology, to have a hearing test. That exam will tell us, is there something blocking that sound wave? Or is the loss nerve loss?